We want justice. We want justice. We want justice. రైతులపై దాడులను అరికట్టాలి. రైతులపై దాడులను అరికట్టాలి.
Subscribe to our YouTube channel and press the bell icon to get the latest updates.
We are outside Gandhi Hospital, which is the key COVID hospital here in Telangana, and about 150 to 200 junior doctors have been sitting on protest since last night, even braving the rain. This comes after one of their colleagues was assaulted by the attendant of a patient who passed away due to COVID. I have with me here the General Secretary of the Junior Doctor Association, Mr. Dr. Hussain, who's going to tell us what exactly happened last night that led to this.
Actually, there was a patient aged about 55 years who was admitted to us. He was brought to SARI unit, severe acute respiratory illness, with symptoms suggestive of COVID. He was tested positive the next day and shifted to acute medical care unit, AMC. And he is a known case of hypertension and diabetes and had pneumonitis. And his saturations because of that were not maintaining. They were around 70 to 75%, for which we had put him on a non-invasive ventilator called as CPAP, continuous positive airway ventilation, pressure ventilation. So, and he was obviously instructed not to go to the washroom because exertion would worsen dyspnea and could potentially lead to anything. Unfortunately, due to reasons unknown, he walked to the washroom even though he had a bedpan by his bed, and there he succumbed to that illness. He had a cardiac arrest, and the doctors obviously immediately responded. Resuscitation was done, and despite best efforts, unfortunately, we couldn't revive him because the lungs were already
He collapsed there and there?
Yes, because the lungs were damaged due to COVID. There was a significant damage to the lungs, and now the doctor, when he told the attendant that your father is pulseless and all, and we will do an ECG to declare his death. So he became furious, and there was a chair at his disposal, and he made an attempt to hit him with that. And it was so intense, believe me, that the chair broke when it hit the ground. And then there was a metal stool that with which he started assaulting, and there was an injury to his hip, to our colleague. And but we are not actually much concerned about that isolated incident. We are worried about the things that led to this. And that, according to the best of our knowledge, is the mounting of cases at Gandhi Hospital, making Gandhi the only hospital in Telangana.
I was coming to that, but I just want to finish what you told me about. So, was there no ward boy or anyone present in the ward to be able to, so that it could prevent that patient from going towards the washroom?
Actually, there are 65 beds in that unit, and there is only one ward boy. He was attending another patient, and in the meanwhile, he left. He had probably, this is what we inquired later, and we were told that he told this patient that just wait, I will be right there. But then he didn't. So
is the issue of shortage of staff also key to this protest that you all have been holding?
Of course, there is a dearth of manpower, and we are exhausted, understaffed over the last 3 months.
I'm going to get to your friend to tell me more about that. What's your name, sir?
Myself, Naresh.
Okay. So please tell us what's been happening here.
Actually, by the time of declaring the death, the attendants were so aggressive that they hit the medicine PG who is posted there with the plastic stool. It has broken by hitting to his elbow. Then after the nurses, the interns who are there in the situation, they enter into a room and lock themselves, so that the one PG who is present there, he was only left there. Okay. Then in the next step, after hitting with the plastic stool, he threw a iron stool onto the doctor. So the intention was to hit on the head, was missed, and hit to the hip of the doctor.
I understand that. So as your colleague here mentioned, what led to this? Clearly, this is not an isolated incident. And just to tell all our viewers out here, Gandhi Hospital is the key government hospital here where all the positive COVID patients are referred. So clearly, the burden has been mounting out as we've seen a spurt of cases in the last fortnight.
What is the root cause behind this is that the incident this has happened is not the first time. This is happening everywhere in every state. First thing is the because of the lack of the protection the government has been providing. And the second thing is that every case from the periphery, from the other district, they are dumping into the Gandhi itself. So the people who are doing since 3 months, they are doing the duties restlessly, 6 hours to 12 hours shifts with the PPEs, draining, dehydrated.
And I also heard some doctors tell me about the quality of the PPEs being compromised upon.
Yeah, quality of the PPEs is being compromised, and the tests are also not being conducted in the Gandhi to the PGs who are doing the duties. Because we are working since 3 months, we are not getting any. Still now, one doctor couldn't come out to be positive. It is unfair. The government is so reckless that they are not at all bothered regarding the health of the doctor. They are not at all. And one more thing is that regarding the quarantine also, there is a 14 days of quarantine as per the guidelines. Following, you can ask any individually, you can ask, no one is taking the quarantine.
In fact, that's something I was coming to, as we've been hearing repeatedly here, that in fact in the last fortnight itself, we've seen about 79 doctors from Gandhi Hospital, from Osmania Hospital, which is another key government hospital here, from King Koti as well, where several doctors and nurses have tested positive, and yet the quarantine facility guidelines are not being followed.
For this issue, they should decentralize it. They should not mobilize the patients from other districts. They should keep the patients who are the patients present in the other district should be settled there only, because every district has its tertiary center. They should improvise the facilities there and should stop there only. Why they are bringing here and putting a lot of burden to the same repeated pages?
I'm going to speak to some women doctors who've been standing here for quite some time. Ma'am, I saw a banner you were carrying a while ago, which
very important.
Yeah, which says one CM is enough for state, but not one hospital. Why this? Tell me. And your name, please.
I'm Dr. Priya. I'm intern here, and we are here since yesterday evening protesting against the violence, and also there are so many things to put in front in the picture. One thing, if you go to any street right now in Hyderabad, you'll find at least 2 to 3 hospitals in there. Why all corona patients only in Gandhi? Why only we have to share the load? Like why we all have to take the load? Why can't they share the load? Why all private hospitals are empty and government hospitals full of doctors? We are working in the dragon's mouth, putting our families at stake. Usually,
and are you guys going back to families? Are you being provided quarantine facilities?
Of course,
going because we don't have any places to stay here. You know, previous days there were issues about doctors being pushed out from the hostels or from the rooms, and we don't even get the rooms because if we say we are working in Gandhi and they're like pushing us out. No,
who is that?
Like there are so many people. They don't give the common people. They don't give the houses for rent. There are so many people out there, but no one knows.
Is it because they suspect you might be a corona?
They may get. We are working in the dragon's mouth, right? Like there are families, there are kids, there are parents, everyone. Not their life is like they think like their life is more and our life is not more. So we didn't even fight for that also any day. But today it is not at all good because they're just coming against the doctors who are putting their life at risk all these days, working their ass off, like working.
And as a result, we are getting beaten up. And this is not the first time which happened. Right. This is not the first time which happened.
We face these things
every day.
But none of them speak.
Just that we don't speak up. But yesterday it was enough. Try wearing. Ask these politicians to wear PPE for an hour and stand in front of us and work with us. Let them realize what we are going through. We are giving that hypoxic stress to ourselves. I'm telling you, if you wear this N95, are you able to breathe? Imagine in PPE. Imagine wearing the PPE and working for hours.
And the last thing you want is that you're beaten up for that.
Yes.
Don't get basic respect. Respect also. We're not asking someone to shower something or just
we don't want flowers.
We just want a basic.
We don't want flowers to get showered.
We're just mere human beings. We're not godly things. We can't predict what happens next. The next second. Now we are standing here. We don't know what happens next. So we are just working ourselves so that we can help people. We came by ourselves to this designation thing because we decided to. We know what it takes to become a doctor.
Yeah.
We know how to work. But then moreover that, on above it, people are coming against us, beating us, although we are like, there are so many incidents. And you know, this is not the first incident which happened, right?
In fact, I want to understand that. Do you all plan to continue with this? What are you expecting out of this?
We want to ask the CM first of all.
And do you see that happening? Your friend here, CM to come here and address.
Do you, ma'am? I'm just questioning you. Do you think this political or
What do you think will come out of this protest?
We are waiting for that actually.
we are waiting since
Imagine why
yesterday
these many
evening.
doctors are on roads today. Why? Since yesterday evening, why? There must be a reason for a doctor to be on the road.
I completely understand,
And,
but-
and what we got back is like nothing, nil.
So since most of you are out on the streets right now and there are so many patients inside, what about
There are
them?
medical officers.
There are
Not that,
yeah.
at any cost, patient first, patient is God, patient first. We have been taught patient comes first, their life comes first. We are never going to keep their life at stake. There are RMOs, there are medical officers working for them.
To keep anyone
Yes,
we have our
definitely.
hypocrite laws which we follow as
Yes.
being a doctor. We have our rules, protocols, whatever it is.
will
There are
follow
few
them.
of them here protesting about this, but they are still working because there are so many lives out there.
I know.
We are just asking the CM to address our problems.
Yeah, to understand.
The next moment we'll join our
And what kind of protection are you expecting? If you could just sum it up in 2 lines for me, what kind of protection or demands are you making from the government?
The basic respect for a doctor, being a doctor in India, and not we're not saying some kind of a city or anything. We're just saying it India. We want a basic respect.
So how do you think will that come? That can't come overnight. Does that mean police protection, STF, as some of your colleagues said?
The media, everyone should react. Everyone should show up.
And
What
people
is
should
that?
get punished.
Yeah.
People who are attacking doctors should get punished. Should be shown on the headline as well. I have seen many times that this patient have done, he raped him, so we
got the punishment and this is the case.
Have you ever seen a doctor who has been attacked by a normal person
That person
is being punished?
and the culprit is not.
I have
shown.
never seen that headline so far. Show that as well, please. I request you guys, please show that. Show that, people who have been, take some action, take some action against the people who are attacking doctors.
Right.
We are here to help people. We are here for the people.
And your name is Dr. Priya
I'm Lekha.
Lekha. And what about you?
Dr. Deepthi.
Thank you. So clearly Dr. Lekha, Dr. Deepthi and Dr. Priya aren't the only ones who are echoing this thought. Quite mentally frustrated in terms of what's been coming on them, and they're saying the least we want is to just treat us with basic amount of respect, no amount of flowers throwing at us, but just to ensure that they are not beaten up for actually doing their duty in a very diligent manner, that too back to back without a break for the past 3 months. We spoke to the Director of Public Health here earlier as well, and they said this would be looked into as well. The nodal officer, of the hospital was also out in the print, spoke to him.
Man holding by one patient after the death. It's only the reactional one, and we will discuss with the students, and probably our Honorable Minister is also inquiring time to time about the patient care and about the issue, and sir also probably he may address.
And so some of them say they're really overburdened, like the hospital is really overburdened. What to do since it's the only key
Not a
COVID
question
center?
of overburden, there is no overburden at all.
What's your name, sir?
Yeah, Nagarjuna.
Okay, Nagasama, if you could also tell us how many positive patients are there at Gandhi at the moment?
At the moment, total 58 positives are there among today's admission.
No, overall.
Overall, 513 patients are there.
And how many doctors are there to treat them?
Yeah,
The number is definitely very less because the significant force is the junior doctors which are on the road. So the
So
ones
the
who are
ratio
there
would be
inside-
about what? Like, could you give us an idea?
the ones who are there inside are the government doctors, the associate professors, assistant professors, and the senior residents, along with some transferred interns, PIs.
No, the reason I ask a number is because I want to try and understand the ratio, since the emphasis has been on how the hospital is understaffed. So if I could get a rough idea in terms of how many doctors.
No, I mean, if you look at the statistics right now, it could be deviating. I mean, it might not be the best. However, in the general times, if you talk about, then overall the staff, the number of doctors might be a good number. However, the ones that we are interested in is the rising number of patients, the rising number of critical patients, the rising number of beds in the ICU, and so the people who are trained to treat them should also increase proportionately, which are not rising.
So that's what I'm saying. How many of you are there right now?
Yes. So there are about 120 people in combined general medicine, pulmonology and anesthesia, all the junior doctors, out of which, because of the upcoming exams from 20th of June, 40 of them are gone. They've been exempted from duty. We are left with 80. Out of 80, 50% of them are on quarantine. The 7 days work and 7 days quarantine. And out of those 40, they are distributed into 2 or 3 shifts. If it's a 3 shifts, then it is 13 doctors per shift. If there are 2 shifts, there are 20 doctors in each shift. So 20 doctors in each shift is very, very less compared to the number of patients that are there. That is usually ranging between 150 to 200. Initially, there were only 20 patients in the ICU. Now it has increased to 200. So the staff should also increase. This is our concern. However, like you pointed out that our superintendent sir, he said that no, we are not understaffed. He could be trying to correlate all the number of doctors that are there, not just the ones who are trained to treat critical patients.
Right.
Everyone here is an MBBS doctor. Everyone is a doctor, obviously. However, people belonging to anatomy, physiology, pharmacology, these people, they are preclinical and paraclinical and are not equipped to train the critical patients.
That's an important point she makes here, but remember that the High Court has also taken, the Telangana High Court has repeatedly taken cognizance of that matter. However, the state government here has been quite adamant to only have positive patients referred to the key COVID hospital, which is Gandhi Hospital here, while several other private institutes and medical centers have been treating COVID patients, but they continue to not have permission from the state to test them for COVID, despite the High Court's instructions to do this. The people here, of course, maintain that they will not get up unless the Chief Minister or the Health Minister addresses them, post which they will submit their formal, demands to them. We have been bringing you the latest. For more such ground reports from the state of Telangana, do subscribe to our YouTube channel and follow us on Twitter, Instagram, as well as Facebook. With Surabhish, this is Anisha Bedi reporting on the COVID pandemic from Hyderabad.